first I would like to ask for your permission to use this video for educational purpose and on internet.
Definitely.
Thank you. Now, most of people put only their fantastic results on internet, but here we have one of those complications that you and I talked about before the surgery. But before we talk about those nerve root irritation that you start having after the surgery, let's talk about how were you before the surgery, your limitation, your daily activity, and I'm going to ask as well your wife to jump in. And how was he before the surgery?
He had a lot of pain.
Okay.
And also the bending over, lifting was...
Ambulation, walking?
Yeah, he couldn't walk anywhere.
Okay. Now, let's talk about the pain that you had before the surgery in the back and some in the right leg. How is that?
That's getting a lot better. It's better.
That's better, but you have a new symptoms. What can you tell us? Just tell us how you feel about that nerve irritation that you have right now.
Just what you said before.
Yeah, just the pain that you have in the left leg.
Radiating down my left leg. It's always in left leg.
Left leg. Okay.
Yeah.
Can you show us where it is?
It'll start. Actually, lately it seems like it's coming from the bottom.
Okay.
The top of the foot.
Top of the foot, which is L5.
Okay. I feel it coming on, and God, I want it to go away.
Is it burning?
It's burning.
Okay. And
I want to rub it, but it's so...
It doesn't go away with rubbing.
No, I can't rub it.
Okay,
It
now,
hurts so bad.
and it is as well somewhere around the knee,
And
correct?
then it'll come up the side of the leg, up to the knee.
And that is L4.
And that'll burn and hurt.
And we did a L3 to S1 OLLIF just 2 days ago, and it seems that the L3 didn't get irritated, L4 got somewhat irritated, and L5 got truly irritated. You have high hip, high iliac bone, and our angle was very, very steep. And L5S1 is always more at the danger of this kind of irritation. And it seems that you got a full picture. Now, you're not weak, and that's a very good prognostic factor, meaning that this is going to come back. And we started you on Neurontin. Now, in the last 2 days, the pain was really bad the night when I come and checked on you.
Yep.
Just right after the surgery. Comparing to that, or comparing to yesterday, do you think it's going the right direction or wrong direction?
I believe we're on the right vein.
Okay, so it's getting a little better.
Yeah.
You said that right now when you're sitting is not bad. Yesterday noon wasn't bad, but in the night.
In the night.
So what did you do over the day? That do you walk with physical therapy?
I walked with physical therapy at noon, and everything was fine.
Okay. But
then in the afternoon we had some talk with some pain specialists, and I started using
gabapentin. We started you on gabapentin, yeah.
One other one.
Muscle relaxant.
A muscle relaxant.
Okay. So
we used that yesterday afternoon and night, and that is definitely helping.
So how bad is that nerve pain right now?
Right now, up in here and all the way down the leg, where it was at a 7-8 this morning, it's at a 3-4 right
3-4. So it goes up and down.
That's what's so hard to live with.
Yeah.
It goes up and down.
Yeah, and depending on the activity, still in the next few weeks may do that.
Right.
Yeah.
But I'm hoping that the trend will be getting better and better.
Yep.
Eventually, you're going to start having that like electricity jolt, like shooting pain going down the leg. And sooner you have it, it's a sign of healing, the nerves healing. Sooner you have it, we know that sooner the nerves are going to come back to their normal equilibrium, and that's a good sign.
Okay. Well.
So, but you have been, even though you have all these things, you have been walking already.
Yep.
Okay.
And you want me to keep on doing that?
Small, frequent walks are always good.
Yeah.
Okay. So, do you have anything to add to how you feel and what the symptoms are, and so far your experience?
Well, the experience has been educational. I mean,
Very.
I have pain and it goes away. You think that's fine, it's done with. No, it comes back again.
Okay, but you told,
goes away.
You told me that you read again that paper that we gave you regarding this.
Yes.
We keep reading it and reading it.
And what do you think? Is it exactly the way it is?
all word for word.
Exactly. Okay.
Yeah.
That's why we give it
And
to
that
the
makes me-
patient.
And that makes me feel good because that's the way it's happened with other people. So.
Yes, exactly. So, and this paper that we put together is on internet, and we give it to all the patients. We talk about that,
Yeah.
Okay.
and statistically, we say we consent the patient for 15% of that. In reality, it's maybe a little less, and 5S1 is where most of patients get that nerve root irritation, and yeah, in a way, we cannot beat the statistic.
No.
Some people are going to get that, and then people are usually surprised when they are in that few unlucky situation. But the good thing is the prognosis of this is very, very good.
That's what we need to hear.
That's
Yeah,
what we need to
within 4 to 8 weeks,
keep telling ourselves.
very, very few people last longer than a month or 2 or 3. But it's just going to be difficult in the next few weeks. Okay, be patient.
Yeah.
That's why they call you patient. Okay.
Okay.
Have
The
a good
key
day.
word is patient all the way through.
Exactly. Have a good. Thank you for the interview.
Thank